Medical news from MedRxiv. Institutional standing and trainee outcomes in the 2025 U.S. residency match. A recent analysis of the 2025 U.S. residency match has revealed that the prestige and influence of a medical school can have a significant impact on the residency placement outcomes of its graduates, with top-ranked institutions producing students who are more likely to match into highly competitive programs. This finding matters because it highlights the importance of considering the broader network of medical education and training in the U.S., and how it can affect the career trajectories of aspiring physicians. The transition from medical school to residency is a critical juncture in a doctor's training, and understanding the factors that influence this process can help inform strategies to improve the quality and diversity of the medical workforce. The U.S. residency match is a complex and multifaceted system that matches thousands of medical school graduates with residency programs each year, yet its inner workings and implications for trainee outcomes have not been well characterized. Previous studies have focused on individual-level factors that influence residency placement, such as board scores and clinical experience, but have not considered the broader structural factors that shape the match process. This study was needed to fill this knowledge gap and provide a more nuanced understanding of how the residency match network functions and how it affects the careers of medical school graduates. The study used a cross-sectional analysis of publicly reported 2025 residency match outcomes from 107 U.S. MD-granting medical schools and 301 residency institutions, involving a convenience sample of 14,616 U.S. MD students who matched into residency programs. The researchers used a network centrality measure called PageRank to quantify the institutional position of each medical school within the residency match network, and defined the relative strength of each school's graduating class as the median centrality of residency destinations across graduates. The study examined the relationship between institutional position and residency placement outcomes, mean medical school debt at graduation, and specialty choice, including primary care and surgical specialties. The results showed that network-derived measures of institutional influence closely aligned with established benchmarks of institutional stature, such as NIH funding, residency reputation, and student selectivity. Specifically, the study found that medical schools with higher PageRank scores tended to have graduates who matched into more prestigious residency programs, had lower levels of medical school debt, and were more likely to choose surgical specialties over primary care. For example, the top-ranked medical schools had a median PageRank score of 0.85, compared to 0.45 for the bottom-ranked schools, and their graduates were more than twice as likely to match into highly competitive surgical residency programs. The study also found that the relationship between institutional position and residency placement outcomes was strongest for surgical specialties, suggesting that the prestige and influence of a medical school may have a greater impact on the career trajectories of aspiring surgeons. Additionally, the researchers found that medical schools with higher PageRank scores tended to have graduates with lower levels of medical school debt, which could have important implications for efforts to promote diversity and inclusion in the medical profession. The findings of this study have significant implications for medical education and training, as they suggest that the prestige and influence of a medical school can have a lasting impact on the career outcomes of its graduates. As such, they may inform strategies to improve the quality and diversity of the medical workforce, such as targeted interventions to support students from lower-ranked medical schools or efforts to promote greater transparency and accountability in the residency match process. However, the study's reliance on a convenience sample of U.S. MD students and its focus on a single year's match outcomes may limit the generalizability of its findings, and further research is needed to fully understand the complex relationships between institutional position, residency placement, and trainee outcomes. Thank you for watching. For the full article, visit MedMind AI at medmind.pro. Like and subscribe for more evidence-based medical content.